everyone, and thank you for joining us. I want to share some information with you. The Ministry of Long-Term Care is implementing temporary enhanced measures in light of the highly transmissible Omicron variant. So I'm going to go through what those changes are. It's like a cheat sheet, so I will send it out to you after the meeting because I'm sure you're not going to remember everything that I'm telling you today. So effective yesterday, general visitors needed to be fully vaccinated to enter the home. So going forward, if you're a general visitor, you must be fully vaccinated. Effective tomorrow, December 17th, essential caregivers who are not vaccinated must receive their first dose by December 20th and show proof that they have had it, or they will not be able to enter the home until they have received their first dose. So if you get your first dose on December 22nd, then you would be able to come in the next day. You must have your second dose by February 21st, 2022, and show proof of both doses, or you will not be permitted into the home until you are fully vaccinated. Caregivers that were designated as caregivers prior to December 14th are required to be fully vaccinated to gain entry into the home. Sorry, I did that wrong. Caregivers designated after December 14th are required to be fully vaccinated to gain entry into the home. So for those caregivers that are already coming into the home who may not be fully vaccinated, the government is giving you a bit of lead time. For new residents moving in, their caregivers must be fully vaccinated. I'm going to talk about surveillance testing. All staff, students, and caregivers are going to be tested a minimum of 3 times a week. So we're going back to what we were doing in the spring, basically. General visitors and support workers, it says regardless of vaccination status, require proof of a negative test upon entry. It could have been taken the day before it can be taken the day of the visit or on a previous day, which basically means that general visitors and support workers will be tested each time they enter the home. Testing is not required for infants under the age of 1. Individuals who show proof of a confirmed COVID-19 infection in the past 30 days do not need to be tested. If you have traveled in the last 14 days, you will need to show proof of a negative PCR test, and you will be rapid tested on site. Visitors, there's a change here. Up to 2 people per resident at a time, including caregivers. It has been 4, it's now been brought down to 2, but that's at a time. So it could be 2 visitors and then 2 different visitors coming in at another time. Residents can designate a maximum of 2 caregivers. So when we talk about that, we're talking about new residents being admitted. For the people that are already living here and had designated more than 2 caregivers, that will be allowed to continue. Children 5 and over who have not been fully vaccinated are not allowed entry into the home. Palliative visits are permitted regardless of your vaccination status. Absences. Day absences for social purposes are permitted for fully vaccinated residents only. Overnight absences for social purposes are to be suspended regardless of vaccination status. So there will be no overnight visits permitted at this time. And I know it's this time of year and it's very difficult. Residents who do go out on a social day absence will be actively screened upon returning. They will receive a rapid test and a PCR test on day 3 following their absence. They will have another PCR test on day 7. No isolation is required for these residents unless they have a positive result. Essential, medical, and compassionate and palliative absences are still permitted regardless of vaccination status. So in order for us to plan staffing for testing and surveillance in the coming holidays, could you please let Chris Burns know, and she's at extension 309. She's also on the email that I sent you. Could you let her know if you are planning to take your loved one out for the day over the next 2 weeks? We need to be planning our staffing. I'm sorry that you will not be able to enjoy Christmas dinner here at the home with your family member. You are not permitted to remove your mask in the dining room or in the residence room. And that's a change too. I would like to remind families that screeners are following protocol and need to be treated with respect. We have been having some pushback, and I would just ask, especially because they're young, that if you have an issue, please speak with management or with a registered staff. They are working really hard to keep your family members safe. If you have travel plans over the holiday season, could you please let us know your status prior to coming back to the home? So usually I would be reading you from the policy resuming visits during a pandemic. It will be revised and sent out to you next week. I've just given you the highlights today. The policy will outline the details of all of the changes. And really, that's all I needed to share with you today. We here at the home just want to wish each and every one of you and your families a very Merry Christmas and a Happy New Year. And if there are any questions, I'm happy to answer them. Someone had asked me if we had data that we could share in regards to statistics on outbreaks in long-term care. We don't receive anything, and when information is shared at the media, that's usually the first time we're hearing it as well. Although we do belong to an association, and they send us some weekly information that tells us how many homes in Ontario are in outbreak. And we found out today that there are 12 homes in Ontario that have an outbreak. An outbreak just means that there are 2 people, residents or staff, who are confirmed COVID cases. So we don't know any more detail than that. Another person asked me, what happens if we go into an outbreak and a resident is tested positive for COVID? So we have the ability here at the home to isolate our residents in their own rooms, which is what would happen. We have a very detailed pandemic plan, which we would initiate the moment we went into outbreak. We have all of the PPE that is required. Our staff have been trained. We have done mock outbreaks to train them on how to respond to an outbreak if it should occur. I think our biggest concern will be staffing. We're already struggling with our staffing, with people having to be off because they've been a close contact with a confirmed case and this time of year. So that will be our biggest challenge. The good thing is Bob Rumble belongs to a group of homes in Simcoe County, and we have what's called a mess team. And so all the homes administrators have come together, and we are working with, well, it was the LHIN, now it's Ontario Health, and they've provided a staff person who is helping us to organize a mess team. So if, for example, our home went into outbreak and we were short-staffed, there are people working for an agency and other homes that would be redeployed to us. And the same would go if another home went into outbreak. We have people working for us from an agency that would be deployed to that home. So hopefully we will never need that, but there are plans that we've tried to make, local plans that we've tried to make, so that we would never get into the situation that happened last year. I think that was the two questions I remember being asked. If there's anything more, I'm happy to answer. Okay, so someone said, I am medically exempt from vaccinations. Will you accept the letter from my doctor to visit my mom? I do know that getting a medical exemption for vaccinations is extremely difficult, but you could send that letter prior to coming to our infection control practitioner, or you could send it to me. We would review it and see if it met with the guidelines that we have been given. So I'm not just going to say yes. I'm going to say, let us see the letter and let us make sure that it is as we have been directed to do. So someone is, Derek, thank you. More statistical information can be found at ontariohealth.ca and search for the latest situation report. We do receive situation reports, but they don't necessarily tell us about long-term care specifically. So I'll just give you another minute in case there are any questions. As I said, this Coles Notes version of the changes I will be sending out today so that you have that. And when you come in, hopefully you will know sort of what's going to be happening. We were talking about Christmas. Over the Christmas holidays, quite often residents receive clothing for gifts. And of course, we want to make sure that they are labeled and not left in the residence room, because what happens is they get lost. So we're thinking that because we're now going to have screeners and people doing antigen testing, that we're going to bring the labeling machine out, and you could ask someone to label your loved one's clothes, and then you can return it to them to their room. I don't think there's anything worse than giving somebody a gift and then saying, okay, I have to take it now and go get it labeled, and then they don't get it for a couple of days. So we'll see if that helps. Okay, so I don't think there are any more questions, but even if you think of something after we hang up, please send me an email. I'm happy to respond. And again, we wish you a very Merry Christmas and a Happy New Year. And please, if you do plan to take your loved one out for the day, I know the ministry is going to be putting out a little sheet that we're to give to you in terms of what you should be looking for and what you should be doing based on the Omicron virus being so prominent, is try to keep it to small gatherings in order to protect the residents that you're taking out, but also remembering that you're bringing them back in, or you're coming in to the home, and we really want to try to keep the home COVID free. So please remember that. Thank you.